action, and monosodium glutamate, and other brain neurotoxins that affect your appetite and cause people to crave the foods that I shouldn't call them foods because sugar isn't, as we consume it, should not be considered a food. It's a drug in the disturbing amounts that people use. But monosodium glutamate and other excitatory drugs that are added to our food supply cause excessive appetite and excessive weight gain and metabolic syndrome, which is the body's inability to use insulin properly. And in a book called The Diabetes Solution, Dr. Blaylock goes on to say that the metabolic syndrome is the cause of type 2 diabetes, as well as hypertension and atherosclerosis. Causes all three of those conditions. Essentially, science proves that excitotoxins trigger the metabolic syndrome and, subsequently, obesity. And we know that the level of excitotoxins added to our food is at least equal to and too often exceeds the amount needed to produce the metabolic syndrome in animals. Yet only a handful of scientists are addressing this alarming association. Recent studies, says the doctor, have shown that monosodium glutamate and aspartame is the synthetic sweetener, and other excitotoxins actually do powerfully stimulate the insulin-producing cells of the pancreas.
Now, can I just say, you were talking about metabolic syndrome, and a lot of people listening are not going to know what that is. Does he define it here?
He did earlier, but
we define it as a fact of it's an insulin resistance. It doesn't mean you have outright diabetes. It's a pre-diabetic manifestation where insulin rises up within the blood and creates a state of inflammation. It creates a toxicity. It can harden and inflame your veins and arteries. It can affect liver function. It can affect
high
brain
blood pressure.
A whole host of different, and of course, a lot of weight gain is caused by this. Carbohydrates raise up, and insulin rises up and becomes less and less effective, and it has a host of different actions on the different organs of the body, adrenal glands.